Hi, Jennifer.
Hello.
So glad you're here with me today. Let's
Thank
jump
you.
right
Me
in.
too. Okay.
So, the first question I have for you, I'm really curious about what led to your transition from physical therapist assistant to the physical therapy program.
Well, I've been interested in transitioning to pelvic floor, and I was looking for jobs here in Texas as a PTA. However, most of the jobs, well, all the jobs I was finding were for PT only. So that was the deciding factor that made me go to become a PT so that I could start pelvic floor.
Hmm, Interesting. Um, so I see on your resume that you do have a lot of experience in home health. Home visits, particularly for postpartum patients, are becoming more common in our country. And as we look to expand our home health care, what are some distinct challenges that you foresee based on your experience as a home health provider?
Well, um, I'm actually very excited about this expansion into home health because this is a very sensitive area for both men and women, and the home is usually where you feel the most comfortable. However, I would think if other people are at their house, like caregivers, they may feel awkward and be uncomfortable.
Mm,
Um, so that could be one thing. Also, they usually just have regular beds, and those are not very conducive for some therapies because they don't move up and down like a high-low table, and they're not as firm, and you can only get to one side pretty easily. Plus, a lot of my patients sleep in recliners, so that could be difficult. But as a home health therapist, what you learn is to just make the best with what you have and get creative, and that helps you get the results that you desire. Also, I would probably be really nervous about bringing in one of our really nice biofeedback machines into the home because they're so expensive. But this is a crucial part of the pelvic floor therapy. So I would use the smaller ones, and they'd be a lot more portable, easier to take to the home, and they're cheaper.
yeah, that makes a lot of sense. Um, the last question I want to put forward to you um, is how you'd handle a more difficult situation. If
Okay.
you say were handed an evaluation for a patient with an unfamiliar diagnosis, how would you go about that? Uh, how would you start your evaluation?
Well, usually I try to look ahead and see what diagnoses I will be seeing for the day. So that way it gives me time to research and to find important information to help me assist the patient. Plus, if I really don't know and it's a unique, unfamiliar diagnosis to me and I can't find much, or I feel like I need a better understanding, I'll ask my coworkers or my other therapist friends and see if they have any helpful tips or hints. And then, most importantly, I would talk to the patient because they know their bodies best and they know what's going on, and they've probably been dealing with it for a while. So I think they would have the best information on top of that.
Yeah, that makes a lot of sense. I think you're right. Thank you. Thank you for your answers and for your time.
Thank you.
You're ready to switch gears?
I guess so. Now I'll look at you.
Okay.
Okay.
I'm
Are
ready when
you
you are.
ready? Okay. Hi, Liddy. Thank you so much for joining us today. My name's Jennifer, and I'm going to be doing your interview. How are you doing today?
Just great.
Excellent. Well, we're going to go ahead and jump on in here. So I see in your resume that you are now performing women's physical therapy. What led you to this?
So there was a need in my clinic uh, where the PT who specializes in women's and men's health needed a PTA, and it seemed like a change of pace that I was ready for. I had been working more with sports medicine and orthopedics and doing a lot of post-operative shoulders and knees, which I really enjoyed, but at the same time, it was getting all the same, a lot routine.
Mhm.
Um, and I felt like there was a lot greater need in the urogenital health field. So that really has led me to working with patients who are more stress and urge incontinence, and that kind of led in working with oncology patients post prostatectomy and after breast cancer treatment.
Excellent. What difficult situations have you encountered with this?
Um, well, several. Um, I think most recently I was in a difficult situation working with a patient, a woman after a radical mastectomy. She was forced to wait several weeks for her physical therapy after surgery because of the COVID-19 restrictions. And she really perseverated on all the negative aspects of her surgery and of the wait and a lot of anxiety that she had because of having to wait. And she required pretty much continuous education and redirection and encouragement. And it took a lot of coordinating between the occupational therapist who was providing her lymphedema treatment, the supervising physical therapist, and myself, as well as her oncology team, trying to improve her body image and her response to the cancer treatment. She's one of my more favorite cases because we had a really good turnaround with the way that she calmed down and was able to, she was able to touch her scar where initially she couldn't even look at it,
Yeah.
as well as her improvements in functional outcomes, decreased pain and shoulder motion. But she was very challenging to get to that point, and it required a lot of patience and walking her through that.
Yeah, it sounds like y'all worked really well with her. Well, talking about COVID, in line with the recent changes in healthcare, um, telehealth sessions are becoming increasingly popular. Are you comfortable treating your patients through telehealth? And what are some challenges you foresee?
So I do feel very comfortable working with patients through telehealth. Um, I think that it can be more difficult, especially with um, women's and men's health patients, to develop a rapport with the patient when you're not working with them in person. But I think taking the time to talk and set them at ease is essential. It's nice to see a patient's home environment and be able to modify their exercise program for what they have right there available. Another challenge can be if the patient is struggling with using the technology. That can be frustrating and negatively impact their session. So making sure that you're working with a system that's really intuitive for the patient and educating them on how to set it up and how to use it can really help. Another frustration that I can sometimes see with telehealth is when you're working with a patient who requires a lot of hands-on intervention, or you can see that they would benefit from more tactile cueing. You can see that they would be good to bring into the clinic for a session and maybe using the telehealth as a backup or a follow-up. But as we've seen with the COVID-19 situation, having the option to do telehealth is really great when you can get a patient to participate in therapy when it's not safe for them to come into the clinic, and you can minimize their risk by seeing them in a telehealth session.
Right. Well, going back and talking about public or pelvic health issues, They can be really difficult or uncomfortable sometimes for people to talk about for some people. How do you show sensitivity when talking to these patients about this subject?
For patients who have a hard time discussing urogenital issues or their pelvic health issues, I think it's important to meet them where they are and learn their comfort level or their almost their personality and how they want to address the topic. I think speaking in a really straightforward way um, can help put patients at ease and let them know that we're going to address it very professionally and letting them know that I'm not embarrassed to talk about these topics and that I have experience in talking about these topics. By asking direct questions, I think you can unlock more personal responses for people who are maybe a little more shy to bring things up themselves. You really have to know what questions to ask. Some people respond okay to light humor or maybe even just acknowledging the awkwardness or the taboos around the situation. Other people, that's not appropriate at all, and you really have to address more like the anxiety and the maybe some body image and body awareness concerns. Ultimately, I think making the patient feel comfortable and letting them know that they're in a safe space to talk about these issues can lead to them opening up and having some breakthroughs in patient care.
Thank you, Liddy. We really appreciate you coming in today.
Thank you very much, Jennifer. This was lovely. I don't know how to do this.
I love the figure in the recording. I don't think I'm the one that can do it.
I don't know how to stop it. Oh no. Okay.
All right, let's just get off.
Okay, great job.
Okay, I'm gonna leave. Bye.
Okay, bye.